Thank you so much. We're going to have a quick panel with Paul Markovich, the President and CEO of Ascendiun, which is the parent company of Blue Shield of California. Paul has been on the healthcare space for many, many years, dedicated his career to transforming healthcare, built statewide health information network for seamless patient care, launched innovative care delivery partnerships with California Medical Association. We have an 18-year partnership with Blue Shield of California. Very excited about the work we do. We started with, way back in 2007 with development and support custom work. Then since 2015, we have been working with Paul and his team on the expansive opportunity we had with TriZetto facets. And now we are involved in the transformation on the cloud, data, and very grateful to you for coming over for the Investor Day all the way from the West Coast. So thank you so much.
It's a pleasure to be here.
So Paul, very quickly, we've been through this partnership journey over the last 18 years. Tell us how you see Cognizant, if you see Cognizant differently, and how the partnership has evolved. I've always asked clients, tell me that one differentiator you believe we bring to the table, which none of our peers. I'm going to put you on a spot.
Yeah.
If you can, if you feel there was something you believe has evolved our partnership for such a long period.
Well, maybe what I'll do is start with the context of where we're trying to go, and then I think it'll be clearer how the partnership helps us get there and why it's valuable to us. So everything for us starts with our nonprofit mission to create a healthcare system that's worthy of our family and friends and sustainably affordable for everyone. So God forbid one of your loved ones needs to access the healthcare system. A, they can afford it, and B, when they access it, they get treated the way you'd want your loved ones to be treated at their time of greatest need. When we've looked at that, we've realized you can't possibly incrementally improve an irretrievably flawed system and make that happen. I mean, there's just so much structural inflation in the healthcare system. The incentives aren't aligned. There's a lot of manual process when it could be automated. I mean, I don't need to tell you this. You live it every day, right? And so what we realized is, well, we have to reinvent the system. Many of you may have seen our announcement back in August of 2023. We went live January 2025 with a completely different pharmacy distribution option. It actually ended up making pretty big industry news at the time. And that was an example of saying, wait, this system isn't working. We've got to start from scratch, think about how it should work, and then make that happen. So we've created a series of things we need to do we need to digitize, simplify, and automate everything we possibly can, get a lot more productivity into the system. We need to align incentives. We need to truly deliver on this notion of personalized care. And we've developed the approach that we want to take to get there. But there's a whole series of capabilities required to make that happen, including you can't get to being integrated with providers the way you need to and truly turn it into a real-time system unless you're fully in the cloud. Right? And unless you're truly taking advantage of the latest in what technology makes available. And there's certain core things you need to do every day. You need to do this also while you're, the proverbial, you got to be able to change the tires while you're driving kind of notion. Because we're still processing a lot of claims every day. We're still answering the phone. So how do you move from this legacy world to this future world?
Yep.
And to me, this is where it's just incredibly valuable. Like 15 years ago, it was around, we started the journey to migrate to facets probably closer to 20 years ago, but over 15 years ago. I think we finished the migration in 2014, but we did a lot of customizations. And of course, we were doing this with on-premises data centers. So what we've structured now is this movement to the cloud.
This is a new version of TriZetto.
Right, and then taking the customization out of the system, which allows it to not only perform better for Blue Shield of California, but creates the platform by which we can then sell and share it with other Blue plans as well, which is a part of our strategy. So, we simply can't get to doing something like resolving all claims in real time, which we absolutely need to do and will do unless we can complete this work together. And so it's really fundamental to us getting to the vision that we have in mind, really achieving the mission that I described at the beginning.
And one of the things what fascinated me is not only are you building the future of healthcare for yourself, you're flipping it around and you want to take it as a utility to other health payers and health plan providers. Yeah. That's fascinating. I mean, it is going to be a game changer for the ones who don't have the capex and the ones who don't have the infrastructure to do that.
Right. Yeah. Well, I mean, we figured out a while ago that it wasn't an existential threat to us, but we're probably investing around 150 million, maybe a little more than that, in capital expenditures. I think you guys call it CapEx. Each year, we probably need to be 2 to 3 times that to really drive the agenda at the level that we want to. But to avoid having that put undue short-term pressure on our rates, we just need more scale to do that. And I went out and basically tried to negotiate, nonprofit mergers for about 5 years, and with other blue plans. And it's not easy to get that done. And what I realized is that all the blue plans loved the business case, but always balked at the potential changes in control. Right? It's just a common phenomenon in nonprofit conversations. So the idea was, well, why don't we create this new entity called Stellaris? It's one of the sister companies to Blue Shield, and Ascendiun's the parent of Blue Shield and Stellaris. And we'll figure out, like, how do you get the value of a merger and scale without merging? So how can I go to the other nonprofit blues and say, you can keep your board, you can keep your CEO, you don't have to go through a regulatory takeover, but we can share a technology platform, we can share capabilities like this pharmacy capability, we can collectively invest at a more rapid scale and accelerate this whole transformation by doing it across, and we can do it a lot faster than we otherwise would. So a part of what we were doing, and again, a part of the reason why this partnership is valuable, is that we're not just trying to get it to perform for Blue Shield, we're creating that platform and that vehicle that that can be multi-tenant and multi-plan. And so, it's pretty exciting.
I mean, we are excited also because this is one of those unique opportunities to create a distribution network for our healthcare assets using a tier 1 strategic partnership of a client. And as much as we do it directly, we now find a client to actually take it to other clients, which is just fascinating. So Paul, one of the other questions which is around in the US for the last couple of years is the healthcare costs in the last 20 years have gone up by 200%. There are only 2 sectors which have significantly gone up on costs over inflation for the last 20 years is education and healthcare.
Yeah.
We've used a lot of technology, but it hasn't actually manifested into productivity gains for the sector. So tell us, how does this change with AI? Yeah. I mean, there's a lot of talk on how AI can be that real inflection point for healthcare.
It can be, and it needs to be. I mean, healthcare is too damn expensive. It's the biggest strategic threat that we face as an industry, is that at some point, there's an economist, I don't remember his name, who was quoted as saying, if something's unsustainable, it won't last forever. And that's healthcare costs. We simply cannot afford to keep paying more in healthcare costs every year than price and wage inflation. At some point, this is going to get fixed. The question is the private sector going to do it? Or are we going to hit some fiscal and political crisis, and is the public, are the politicians going to come and solve this thing for us in terms of affordability? So this is really our obsession. Like, the biggest challenge we have with our mission is getting to affordability. And healthcare has had this perpetual negative productivity problem. I mean, literally, if you just look at the macro numbers, we just keep throwing more and more money into it at a higher rate than the rest of inflation. And macro quality scores don't budge. Macro satisfaction scores nationally don't budge. So we just keep throwing more money at it and not getting any better outcomes or output. That's just, absolutely negative productivity. So to me, what it boils down to is you have to, and you look at it and all these opportunities abound. I mean, we still, a year and a half ago, I had my own little sports, weekend warrior injury. So I went and got an MRI, I saw an orthopedist. I go to the MRI, I get done, they hand me a CD-ROM. I go to my orthopedist, and he proudly hands me the printed fax that he sent to refer me to a physical therapist. And by the way, all these people know who I am, right? So this is the San Francisco Bay Area in 2023, and we're using faxes and CD-ROMs. Like, I don't have anything in my home that can read a CD-ROM. I don't know if you do, but maybe you guys do, because this is investment platform sometimes.
We are a next generation company. We
okay. But, we just have so many opportunities to do it, but we need two things. We need will and we need skill. Will means you've got to get the incentives lined up for everybody, including the physicians, the hospitals, everybody, to be more productive. And people don't understand sometimes. They jump into healthcare and they start applying technology, and they don't understand. It's like, wait a second, if I get more productive and I can't charge as much, you're cutting into my revenue. So if there isn't the will, like if I'm doing fee for service and I'm doing less service, that's not necessarily a good thing for my bottom line. So somehow you got to get the incentives aligned where you're motivated. That's what I mean by will. You're motivated to actually do the right thing and be more productive and get administrative costs down and automate. And I think folks tend to overlook that. You've seen a lot of technology get thrown at the healthcare sector, and they forget the fact that if you're not motivated as an organization to do it, you're not going to do it. The second thing you need is skill. That's where artificial intelligence comes in. There's opportunities, I think, abound, whether it's in ambient dictation for physicians, which we've been using we've got physicians that are seeing 2 to 3 more patients a day and going home earlier and not spending as many hours because their voice is being captured. It's immediately capturing the electronic medical record and the clinical notes. It can be applied in getting to real-time prior authorizations, real-time claims, real-time quality calculations and scores, real-time value-based payment all of this stuff can do. That's the vision that we have. Basically, is we've already created for our members a comprehensive digital health record that brings together the electronic medical record information from the physicians, the hospitals, labs, pharmacies, and then that's a basis for 8 use cases, which include the things I mentioned: real-time claims, real-time prior authorization, real-time calculation of quality scores and care gap interventions, and the list goes on, basically. But that drives huge administrative and productivity savings. It enables pay for value and the alignment of incentives with physicians and hospitals, and potentially gets to much better quality of care as well.
In fact, on the TriZetto platform, we now have integrated OpenAI interfaces. We have an AI assistant. We have auto adjudication of claims, which has gone through significant jump. In fact, I was actually in one of the customer service functions of one of the payers, and the amount of work we think we can reduce using AI and actually transfer that money to value care, as you said. One of the other exciting transformations which is going to happen in healthcare for sure, I think, is vertical integration, payer providers, so that the incentives are aligned. And we think it's a unique, big opportunity for transformation for companies like us, because you have to integrate the systems of the payers and the providers together to create more straight-through processing. Is that coming on the way, you think? Or?
Oh, it has to. There's just no way to unlock this value unless that's the case. And it can't possibly come, you're not going to have a whole bunch of Kaisers nationally, because it's too expensive and too intense to go out and just buy physician practices. And then, these are highly paid professionals. They don't tend to stick around. They'll walk with their feet if they're not, let their feet do the talking. So I don't see a whole bunch of big consolidated ownership of physicians by health plans.
But you do see payer provider.
But that's what I'm saying is you have to integrate.
Yeah.
You're going to have that ability to say, if I'm a member of Blue Shield of California, I should just be able to go on your app and schedule an appointment with a doctor. That means you need to be integrated with the scheduling software. Right? I should be able to just, when I walk out of the physician's office, my claim should be settled. I should just be able to do, touch a button and pay whatever whatever I owe in terms of out of pocket. So all these things that I talked about before, quality scores, claim settlement, pardon me, risk adjustment, all of those things have to require the integration, the technical and workflow and operational integration between the payer and the provider. I don't see how a health plan in the future is going to be able to be effective without doing that well.
Absolutely, and that'll also integrate the incentives. I mean, one of the biggest challenges for higher cost is there's no incentive for the providers to reduce costs. There's no incentive for the patients to take more proactive, care because somebody else is paying for them. So that might actually be a good inflection point to change the way the industry works. I'm going to ask you one other quick question. There's a lot of talk about Medicaid and Medicare going through some change. What would be your view? I mean, the current administration is already talking about it.
Right.
What's your view on it?
Well, look, I think a great way to be wrong is to make political predictions with this administration. And so, I just take this with a massive grain of salt. But what I would say is that it's easy to talk about really big, dramatic cuts in things like healthcare spending. It's a lot harder to actually do it. And I think you're seeing that right now in the sense that...
Will it come back in some other form, Medicare?
Well, here's the my understanding of where it is now politically, and just bear in mind, there could be a tweet in 15 minutes and all this could change. So, but the House basically said, we're going to put a placeholder in and save $880 billion in Medicaid expenditures. We're not going to touch Medicare. The Senate, they had to reconcile the bill. The Senate did nothing. So the Senate was zero, and the House was $880 billion. And what they agreed to do process-wise in this reconciliation is that the Senate is looking at, no, we're not going to just pick a number. We're going to pick policy changes that we want to make. Like maybe we'll do work requirements. Maybe we'll do reconciliation or mediation of your membership eligibility as frequently as monthly. Things that, and then we will figure out what that saves after we've done it. So they seem to be, based on that, unlikely to touch what people call FMAP, which is the percentage of amount that the federal government pays. And they're far more likely to be in the $100 to $200 billion range in terms of savings rather than $880 billion. Now, again, go back to my first statement, making political predictions is just a folly, I think, in this world. I think that's where it stands right now. I think that there's too many Republicans that are in states and districts where there's a large number of negative impacts for really big cuts. And an example, David Valdeo from California lost his House seat in 2018 after he voted for repeal and replace, then won it back a couple of years later. And a guy like that is like, yeah, he's seen this movie before, right? I mean, his whole district is something like close to 70% Medicaid coverage, right?
So Paul, we are very excited.
He's in a Biden plus something district. So I look at that and say, I don't see there's going to be changes.
Which is good for technology. I mean, technology is going to be an enabler for change. So,
but the fact is that, that's why I think that the private sector has to do this. We got to do this, and we've got to use technology as a driver to make it happen, to get the costs and trends down. Because I think the private sector needs the government, and the government needs the private sector. I don't see Medicare fee-for-service saving Medicare from a cost standpoint long term. That doesn't mean the Medicare Advantage program doesn't need to be restructured and changed, or there might even be changes in Medicaid. But the fact is, I don't see on the immediate horizon, like these big, really large cuts. There will be some probably in Medicaid, but the long-term challenge remains. And that long-term challenge is it's getting shorter term as costs keep going up the way that they are. And they all come back to, how do you drive improved productivity?
Yep.
You can't drive improved productivity without the application of technology.
In fact, we are very excited. It's our largest industry vertical. We are the largest tech services provider in healthcare in the United States. $500 billion of claims go through our platforms. 2/3 of the insured population in the United States is on our platform. So we're very, very excited about the change, the transformation, the extraordinary relationships we have with clients like you. Any quick question? Well, we can take one. We're running out of time. Any quick question from any one of you to Paul? Yep.
Yeah. Hi. Yeah. Yeah.
Did you hear the question?
Yeah, I did hear the question, and it was about whether the transparency is going to jumpstart some of this change, right? I sure hope so. That said, I've also watched as entities have actively thwarted it. So in the first Trump administration, they issued a requirement to be transparent with all of the negotiated prices between hospitals and health plans. And then the hospitals went and posted this information, and you need to be a rocket scientist, a physicist, an actuary, and you still can't piece together how to compare one plan's rates versus another. So they sort of intentionally made a complex thing more difficult to track, but ostensibly abided by the transparency requirement. So I hope so. I would love to see way more transparency, that the system is entirely too opaque. I think it has the potential to have that driving force, if you will. But I'm also mindful of how active self-interest can undermine it sometimes.
Yeah, but in that example, if we just use the agent that was just shown to us
Right.
about an hour ago, we could actually parse through that complexity pretty quickly.
It also bursts the silos. AI is one of the biggest silo busters.
Yeah, but they sort of also, I hear you. There's things like they'll selectively withhold a certain piece of information that you need, like what's the stop loss threshold on the contract, so I know when I hit that stop loss. But anyway, I won't get into too much technical detail, but it's amazing the creativity that can go into trying to block transparency. But I agree with you, artificial intelligence and policy can really help.
I mean, even the agentification is going to be huge productivity. I mean, the number of areas we are thinking we can tap into just by agentifying. There are tens of thousands of people who just process claims in every payer. So Paul, thank you so much. Thanks for spending time with us. Thank you for coming here all the way from California. And we are very excited about the strategic partnership and the ability of Blue Shield of California to take the TriZetto platform to other, to other payers and create a network for us. Thank you again.
It's my pleasure. Thank you, Ravi.
Thank you.